Some commonly used medical mental illness terms in long-term care. Alzheimer's, progressive mental deterioration that can occur in middle or old age, due to generalized degeneration of the brain. It is the most common cause of premature senility. Behavioral problems, difficulties or problems caused by someone's behavior. Assessment, systematic arrangements for assessing the health and social needs of people accepted by the specialist mental health services. A care plan, the formation of a care plan which addresses the identified health and social care needs. Delusions are bizarre thoughts that have no basis in reality, also a medical and mental condition in which you believe things that are not true. Dementia, significant loss of intellectual abilities such as memory capacity, severe enough to interfere with social or occupational functioning. Dementia is a problem in the brain that makes it hard for a person to remember, learn and communicate. Eventually it becomes difficult for a person to take care of himself or herself. This disorder can also affect a person's mood and personality. Criteria for the diagnosis of dementia include impairment of attention, orientation, memory, judgment, language, motor and spatial skill and function. By definition, dementia is not due to major depression or schizophrenia. Coping skill are the behaviors, thoughts, and emotions that you use to adjust to the changes that occur in your life. De-escalation refers to behavior that is intended to escape escalations of conflicts. It may also refer to approaches in conflict resolution. Sundowners, a person with dementia who becomes increasingly irritable or difficult as the day progresses. Early intervention, a process used to recognize warning signs for mental health problems and to take early action against factors that put individuals at risk. Early intervention can help people get better in less time and can prevent problems from becoming worse. Empowerment, giving people the skill, knowledge, attitudes and power to allow or enable them to be more responsible for their own lives. Health and care. Hallucinations. Hallucinations are experiences of sensations that have no source. Some examples of hallucinations include hearing non-existent voices, seeing non-existent things, and experiencing burning or pain sensations with no physical cause. Mania, a symptom of bipolar disorder characterized by exaggerated excitement, physical overactivity, and profuse and rapidly changing ideas, scattered or tangential thoughts. A person in a manic state feels an emotional high and general life follows their impulses. Managing disease. This involves making a diagnosis, deciding on a plan of treatment which may involve medication, therapy, training, and will include regular review and giving information to patients and their careers. Some commonly used medical mental illness terms in long-term care. Mental health, a state of emotional well-being in which an individual is able to use his or her thinking and feeling abilities, live with others, and meet the ordinary demands of everyday life. Mental illness, health, a state where the person's mental health is disrupted so that their thinking, emotions or behavior are affected to an extent that it has an effect on their daily life. It does not necessarily mean that they have a diagnosable psychiatric disorder or need any form or medical treatment. Mental well-being, a good or satisfactory condition of thinking, feeling and living, a state characterized by health, happiness, and prosperity. It is a broader term than mental health and includes the wider aspects of a person's life, not just how they feel. Obesity, being significantly overweight. Having a body mass index of over 30. Person-centered care puts the patient at the heart of diagnosis and treatment. Patient-centered care explores the main reason for the consultation, seeks an integrated vision of the patient's world, finds common ground and creates a mutually agreed management plan, enhancing health promotion, and providing a solid basis for the long-term doctor-patient relationship. Patient-centered care is therefore based on the patient's problems, the patient's needs, their feelings and beliefs, and the skills and support they already have to combat their problems. Practitioner, a person who practices a profession or art, anyone licensed to provide healthcare services. Primary care, community services which provide open access to patients. They include GPs, pharmacists, and dentists, district nurses and health visitors and many others. Also Cal-led Tier 1 services. Psychiatrists. A consultant psychiatrist usually works in a community mental health team which is involved in looking after people living in a certain area. Team members include trainee psychiatrists, social workers, community psychiatric nurses, psychologists and others. Psychosis. A severe mental disorder in which thought and emotions are so impaired that contact is lost with external reality. Psychosis is characterized by an impaired relationship with reality. It's a symptom of serious mental disorders. People who are experiencing psychosis may have either hallucinations or delusions. Hallucinations are sensory experiences that occur within the absence of an actual stimulus. LOA leave of absence, when a resident is gone at least a day. AMA against medical advice. Resident leaving. Did not sign their paperwork outside pass with staff, themselves, or guardian-approved person, has signed out on unit and front desk. Psychotic break indicates the first onset of psychotic symptoms for a person or the sudden onset of psychotic symptoms after a period of remission. Symptoms may include delusional thoughts and beliefs, auditory and visual hallucinations, and paranoia. Elopement. Legal lie defined as a patient who is incapable of adequately protecting himself, and who departs the health care facility unsupervised and undetected. Some commonly used medical mental illness terms in long-term care. Wandering wanderer defined as occurring when patients aimlessly move about within the building or grounds without appreciation of their personal safety. Suicide is the act of intentional lie causing one's own death. Mental disorders, including depression, bipolar disorder, schizophrenia, personality disorders, anxiety disorders, and substance abuse, including alcoholism and the use of benzodiazepines, are risk factors. Suicidal ideation, also known as suicidal thoughts, is thinking about, considering, or planning suicide. The range of suicidal ideation varies from fleeting thoughts to extensive thoughts, to detailed planning. Homicide is the act of one human killing another. A homicide requires only a volitional act by another person that results in death, and thus a homicide may result from accidental, reckless, or negligent acts even if there is no intent to cause harm. Homicidal ideation is a common medical term for thoughts about homicide. There is a range of homicidal thoughts which spans from vague ideas of revenge to detailed and fully formulated plans without the act itself. Many people who have homicidal ideation do not commit homicide. 50 to 91% of people surveyed on university grounds in various places in the United States admit to having had a homicidal fantasy. Homicidal ideation is common, accounting for 10 to 17% of patient presentations to psychiatric facilities in the United States. Volition or will is the cognitive process by which an individual decides on and commits to a particular course of action. It is defined as purposive striving and is one of the primary human psychological functions. Others include affect, feeling or emotion, motivation, goals and expectations, and cognition, thinking. Volitional processes can be applied consciously, or they can be automatized as habits over time. Habit, or want as a humorous and formal term, is a routine of behavior that is repeated regularly and tends to occur subconsciously. Behavior is the actions and mannerisms made by individuals, organisms, systems or artificial entities in conjunction with themselves or their environment, which includes the other systems or organisms around as well as the inanimate physical environment. It is the computed response of the system or organism to various stimuli or inputs, whether internal or external, conscious or subconscious, overt or covert, and voluntary or involuntary. Affect is a concept used in psychology to describe the experience of feeling or emotion. The word affect is a noun being seldom used in other fields. In psychology, affect mediates an organism's interaction with stimuli. The word also refers sometimes to affect display, which is a facial, vocal, or gestural behavior that serves as an indicator of affect. Blood sugar, or glucose, is the main sugar found in your blood. It comes from the food you eat and is your body's main source of energy. Your blood carries glucose to all of your body's cells to use for energy. Diabetes is a disease in which your blood sugar levels are too high. Some commonly used medical mental illness terms in long-term care. Guardianship. Guardianship is a court procedure through which a person or organization is given the responsibility to make decisions about the medical care of another individual. But to be clear, only medical, not financial. Conservatorship. The financial court proceeding. In order to have a guardian appointed, a person, the ward, must be unable to make informed decisions independently, incompetent, and the guardianship must be necessary to provide continuing care and supervision of the individual. Stimulus is any object or event that elicits a sensory or behavioral response in an organism. In perceptual psychology, a stimulus is an energy change, light or sound, which is registered by the senses vision, hearing, taste, etc. and constitutes the basis for perception. In behavioral psychology, i.e., classical and operant conditioning, a stimulus constitutes the basis for behavior. The external, perceived object and the proximal stimulus, the stimulation of sensory organs. In experimental psychology, a stimulus is the event or object to which a response is measured. Thus, not everything that is presented to participants qualifies as stimulus. As a stimulus, even if a response to such an event is measured. Cognition is the mental action or process of acquiring knowledge and understanding through thought, experience, and the senses. It encompasses many aspects of intellectual functions and processes such as attention, the formation of knowledge, memory and working memory, judgment and evaluation, reasoning and computation, problem solving and decision making, comprehension and production of language. Intellectual functioning refers to the general mental ability that includes reasoning, planning, problem solving, abstract thinking, comprehending complex ideas, learning quickly and learning from experience. Significantly limited or impaired intellectual functioning characterizes intellectual disabilities. Hospice, a home providing care for the sick or terminally ill. Recovery. This may not mean cure but does include not only a significant reduction in symptoms but also an improvement in the ability of the individual to lead an abnormal life including work, home life and leisure. Mental health recovery is a journey of healing and transformation enabling a person with a mental health problem to live a meaningful life in a community of his or her choice while striving to achieve his or her full potential. Secondary care. Specialist health services which are usually hospital-based and serve a wide area, such as a county or a large city. Apart from accident and emergency services, they are usually accessed through a referral from a primary care professional. Self-management, where a patient develops the knowledge and experience which enables them to be able to monitor their condition and modify their treatment with the full support of healthcare professional. Some commonly used medical mental illness terms in long-term care. Service provider, a person or an organization that provides a service to a member of the public. This can be an NHS body, a small local group or a national voluntary sector organization. Stigma is discrimination, based upon society's fear and ignorance about an illness or a problem. It causes peoples to be marginalized and mistreated, and therefore leads to social isolation, health inequalities and many forms of discrimination. It is derived from the term used to describe the marks burnt onto Roman slaves. Hypoglycemic is a condition caused by a very low level of blood sugar, glucose, your body's main energy source. Hypoglycemia is often related to the treatment of diabetes. However, a variety of conditions, many rare, can cause low blood sugar in people without diabetes. Hyperglycemic is a defining characteristic of diabetes, when the blood glucose level is too high because the body isn't properly using or doesn't make the hormone insulin. Eating too many processed foods may cause your blood sugar to rise. You get glucose from the foods you eat. Urinary tract infection. UTI is an infection in any part of your urinary system, your kidneys, ureters, bladder and urethra. Most infections involve the lower urinary tract, the bladder and the urethra. Women are at greater risk of developing a UTI than are men. PRN medicines that are taken as needed are known as PRN medicines. PRN is a Latin term that stands for pro re nata, which means as the thing is needed. It's important to know the difference between daily and as needed medicines. Baseline behavioral baseline, a steady state of behavior against which the effects of introducing an independent variable may be compared. This level of tantrums could then serve as a behavioral baseline to assess the effectiveness of a treatment regimen. Also Cal-led behavior baseline. Instability, a conditioning which someone's mental state often changes. Decompensation is the psychological term used when a person is showing signs of deterioration regarding their daily functioning, such as working, doing housework, errands, and personal care. When someone is no longer able to cope and manage their typical daily activities, they should seek professional help to overcome symptoms of decompensation. Milieu, a person's social environment. Behavior modification, the alteration of behavioral patterns through the use of such learning techniques as biofeedback and positive or negative reinforcement. Positive reinforcement in operant conditioning. Positive reinforcement involves the addition of a reinforcing stimulus following a behavior that makes it more likely that the behavior will occur again in the future. When a favorable outcome, event, or reward occurs after an action, that particular response or behavior will be strengthened. Negative reinforcement, a response or behavior is strengthened by stopping, removing, or avoiding a negative outcome or aversive stimulus. Some commonly used medical mental illness terms in long-term care. Long-term care is a variety of services which help meet both the medical and non-medical needs of people with a chronic illness or disability who cannot care for themselves for long periods. Long-term care can be provided at home, in the community, in assisted living facilities, or in nursing homes. Long-term care may be divided into 3 levels: skill-led care, continuous around-the-clock care designed to treat a medical condition; intermediate care, intermittent nursing, and rehabilitative care provided by registered nurses, licensed practical nurses, and nurses' aides under the supervision of a physician. Skill-led care, continuous around-the-clock care designed to treat a medical condition. This care is ordered by a physician and performed by skill-led medical personnel, such as registered nurses or professional therapists. A treatment plan is established. Intermediate care, intermittent nursing and rehabilitative care provided by registered nurses, licensed practical nurses, and nurses' aides under the supervision of a physician. Custodial care, care designed to assist with one's activities of daily living, such as bathing, eating, and dressing. It can be provided by someone without professional medical skill but is supervised by a physician. Home-like environment. The concept of home is now being taken up by many long-term care facilities who wish to provide comfortable living arrangements for their residents. In terms of care policies, the notion of home also tends to be idealized in both regulated and unregulated settings. These contrasting attributes can include non-daily rigid routines, personal space where an individual is free to make choices and decisions, feel safe and secure, be reminded of fond memories, and maintain a certain sense of control.